You're Chief of Party of the CAP-TB project, that's Control and Prevention of TB. Can you tell me all about it? What are you doing?
Yes, so the CAP-TB project is funded by USAID. It is the Control and Prevention Tuberculosis project. We focus on MDR-TB elimination in the Greater Mekong subregion, 3 countries, China, Myanmar, and Thailand.
How big a challenge is drug-resistant TB in those 3 countries?
It is quite big. I would say it's probably the most urgent priority in Myanmar and China, and a little bit less so in Thailand, although there is some concern that there may be emerging and worsening drug resistance in Thailand that we haven't yet detected.
And can you tell me a little bit about the tools that you're using to implement this project?
Yes, the overall goal of the CAP-TB project is to develop a model for MDR-TB elimination that is effective and has impact on primary TB outcomes such as case detection and treatment success. And we do that in each of the countries, which is somewhat challenging because the countries are so different, so we need to take the context into close consideration.
And how are you implementing that with workers in the field?
Yeah, absolutely. We have local partners in each country. The project is primed by FHI 360, so that it's a prime cooperating agency, and then in each country we have local partners. So we've got a whole team on the ground of local NGOs who work with community supporters, who work with clinicians and public health professionals in order to carry out the interventions of the project.
Could I ask you then about some of the countries you're involved with? First of all, China, what are you doing there and what have you found?
In China, we have been implementing in Yunnan province, which borders Myanmar, Laos, and Vietnam. And it has a population of 46 million people. It is one of the poorest provinces in the country, and we work there very closely with the Yunnan Center for Disease Control, TB division, with a specific focus on mobilizing the community and educating patients and also training peer counselors. Those are some of the most innovative things that we do.
Now, we're here at the conference in Barcelona. What have you heard about data emerging from China that might cross-fertilize with some of the things you're doing?
There are quite a few abstracts, nearly 40, I believe, here at the conference coming from China. I think probably the ones that are of the greatest interest to me are the ones on tobacco control, and they're quite varied in terms of the content. Some of them have to do with mass media to impact health policy. Others are focusing more on smoking cessation. And I think for all of us working in TB, we would definitely agree that smoking-related lung disease is a big risk factor for TB.
What about Myanmar? What are you doing there?
So in Myanmar, one of our primary interventions is direct patient support through a comprehensive living support package. So we provide psychosocial support to the patients, we give them monthly nutrition, we also give them transportation support so that they can come to their clinic appointments on a monthly basis.
Again, here from the Lung Conference in Barcelona, what have you heard about Myanmar that might help your work with CAP-TB?
There have been some really interesting abstracts from Myanmar. I think one of the most interesting that I've seen is the first mortality study ever to be conducted at the community level in Myanmar, and mortality for TB in particular. And they looked at 2 townships in particular and found that men and the elderly, those greater than 60 years of age, were overly represented in the mortality data, about 60%.
And what might be the significance of that?
Well, I think that's a really good question. One of the questions would be whether men are developing more significant disease, TB disease, whether men are presenting at a later, more advanced stage of disease so that they have a higher risk of death. It could be that men also have more comorbid diseases, so maybe they smoke, they could drink, So I think it's actually something that definitely introduces new questions that should be answered.
And in terms of drug-resistant TB in Thailand, the third of the countries, what are you doing there in your project?
In Thailand, we focus on Rayong province, which is in the southeast corner of the country. It's a coastal province. So although we don't border Cambodia directly, there are a lot of people who come to Rayong from both Cambodia and Burma. And it's actually quite an industrial province with a lot of fisheries, and so it attracts people from all over the country. This actually introduces one of the biggest challenges to TB and MDR-TB control in Rayong province because of the mobile population. Now, one of the main things we've been doing in Rayong is building the TB team. And it takes a team to treat TB. This is one of my mottos. So what we do is we work with a multidisciplinary team. We meet with them once a month. We work with them on programmatic coordination for TB as well as standardized clinical management.
A very imaginative, exciting project then. Have you got some take-home messages already, practical messages for anybody dealing with TB and especially drug-resistant TB?
Well, the project is a little over halfway done now. We have 2 more years, and so in this coming year, actually, we are really going to be focusing on analyzing data from the project. We want to see whether or not our interventions have an impact on some of the key indicators for TB, case detection and treatment outcomes. So in the coming year, I would say that we'll definitely have more numbers to support what we're doing, but as of now, I would say that it definitely looks like educating patients in China, in particular, that educating patients using innovative methods with social media, with peer counselors, and with focused counseling from the healthcare sector, that is actually making a difference in treatment adherence and in loss to follow-up.
And if you were to say a slogan or a few words of action plan, what would those words be?
Well, I think that focusing on strengthening the health system is really critical. This is actually a theme that we've also seen during the conference this week. So if I were to say in one sentence what the project is all about, I would say we are strengthening health systems using a patient-centered, community-driven strategy. We really want to think about the patients at the center of the health system and use that to basically guide our strategy.